So again, welcome back to Learn Medics. Today we are going to deal a topic of PSM. So reading the question, you have two questions over here. Reading the two questions. So tobacco control law is which level of prevention? So our topic is levels of prevention. Again, second question, hand washing during COVID-19 pandemic is what type of prevention? So we are discussing the levels of prevention. As the options, we have four levels of prevention. Yes, we have four levels of prevention: primary, primordial, secondary, and tertiary. But the thing is, the order is not right this way. The order is first one is primordial. Okay, primordial is the first one. Primordial, then we have primary, then we have secondary, and then we have tertiary. That is the order. So first one is remember, first one always is primordial. So what is this primordial? Hmm? Primordial level is levels of prevention means it's nothing but preventing the risk factor. Okay, preventing the emergence of risk factor, preventing emergence of what risk factors. So we are preventing the risk factors not to come in a community or not to come in a population. For example, for this I am giving one famous example. Like you know that Gujarat, the state Gujarat have been adapted a law that alcohol is banned. So alcohol is banned in Gujarat, as maybe of you, some of you all know that. Okay, so what is this? This is level of primary level of prevention, because alcohol is itself a risk factor for lot of stuffs. Okay, it's a risk factor for hepatitis, it's a risk factor for certain cancers. So alcohol is so preventing alcohol in a state, it's a kind of primordial prevention. Or another example is like screening for yellow fever in airports. Yellow fever is exotic in India. So any person coming from the countries that are prone to yellow fever, so screening them is a kind of it's a kind of primordial level of prevention. So it is nothing but preventing or like preventing the risk factor, emergence of risk factor, preventing the emergence of risk factor. Risk factor is not there, but we are preventing that risk factor is not able to come in a community or what community or population. So that is primordial. And the second level of prevention is primary prevention. So what is the next thing is primary prevention. So what is primary prevention? Let me take blue color. Primary level of prevention. So in primary level of prevention, already risk factor are there. Okay, risk factor is present. Risk factor is present, but we are preventing the disease not to come. Like we are preventing the already a person or a population is prone to risk factor, but we are preventing that risk factor not lead to disease. Okay, that is primary level of prevention. It's nothing but preventing the onset of disease or condition that aims to promote health and prevention in the occurrence of a risk factor. Risk factor is already there, but we are preventing that risk factor doesn't lead to disease. For example, the question itself, tobacco control. We know that tobacco is abundantly available in our market. So tobacco control law, it's a kind of what kind of prevention? Primary level of prevention, nothing but primary level of prevention. It's the answer. Tobacco control is nothing but primary level of prevention. That is the answer of this question. But we need to go further. We need to deal other two preventions or levels of prevention. So in primary prevention, what is there? Risk factor is also already present, but we are preventing that risk factor is not leading to disease. Okay, that is the primary level of prevention. Then what is about secondary level of prevention? Let me take any other beautiful color, green. Okay, so secondary level of prevention. What is secondary level of prevention? I am writing secondary. Okay, what is the secondary level of prevention? It's nothing but disease is all, risk factor is there, disease is there. Okay, aimed to diagnose the disease as early as possible. So it's a kind of diagnosing a disease in early stage. Okay, for this example, for this we can say pap smear screening. mammography, CT, MRI, everything that are used to detect any kind of thing that is um, like secondary prevention. For example, mammography after 40 years of age. It's a kind of secondary level of prevention. If any suspected case is there, so we can go further for treatment, like either mastectomy or chemotherapically we can deal with that. So early diagnosis, nothing but diagnosis in early stages. Already we have risk factor and disease are there, but early we are diagnosing it. Okay, then what is tertiary level of prevention? Okay, let me change the color to any other nice color like red. Okay, so it is the last stage, so I choose red. Okay, what is tertiary level of prevention? Tertiary level of prevention is nothing but already we have risk factor is there, disease is there, but we are preventing that disease to become a disability. Okay, preventing a disease to become a disability for a patient. For example, a woman of 65 years old, suspected from any lump in breast, so she have done what mammography. He find out a massive tumor which is prone to metastasis, is found on the upper quadrant, so surgeon suggests mastectomy. She gone for mastectomy. So mastectomy is, it's a kind of what, it's a kind of disability for that girl. But this thing is, we in tertiary prevention we are preventing any kind of disability. Okay, mastectomy is a disability, amputation is a disability, so we are preventing preventing the disability not to happen. For example, a patient underwent a limb surgery, got gas gangrene, so we are preventing that gas gangrene to avoid amputation. So like that, you understand the idea. That is all level of prevention. We have primordial level of prevention, primary level of prevention, secondary level and tertiary level of prevention. In primordial, we are preventing risk factor not to come in a community. In primary level of prevention, risk factor is there, but we are preventing disease not to come in a community. In secondary level of prevention, we have risk factor is there, disease there, we are preventing, we are diagnosing the disease in early stages to avoid any kind of things. And in tertiary, we are avoiding the disease not to come in a disability. So this is the all level of prevention. And here tobacco control law is which level of prevention? Is nothing but primary level of prevention. And hand washing during COVID-19, next question, hand washing during COVID-19, already risk factor is there, what is COVID-19 is there, so hand washing nothing but our primary level of prevention. Okay, that's all for today. Let's meet on any other day with some good topics. Okay, thank you guys. Just follow and subscribe to my channel. Okay, thank you.